Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's media availability. Spanish interpretation is available on ATXN 3. To start, Austin Public Health Director Stephanie Hayden Howard will first say a few words, followed by Dr. Mark Escott, Interim Austin Travis County Health Authority, then Janet Pichette, Austin Public Health Chief Epidemiologist. We will then open it up to our pool reporter who will ask questions on behalf of the media. Stephanie, over to you.
According to the Texas Department of Health Services, about 25% of Austin Travis County residents have received at least one vaccine. We are very excited about that news. However, we're not out of the woods yet. We really need to continue this process in order to move us along, allow us to provide more vaccines to the public. But in the meantime, it's going to be important for us to continue to wear your mask because we're not out of the woods yet. At this time, I will transition over to Dr. Escott.
Thank you, Stephanie. And again, we are excited to be making significant progress in our vaccination efforts throughout the county. As Director Hayden Howard mentioned, we're at 25% for those individuals who are 16 years old or older. When we look at our group of the individuals 65 and older, it's more than 50%. And that's going to certainly help mitigate the risk of an overwhelming surge in the future. However, we're not out of the stage of risk yet. We're still in stage 3. And of particular concern right now is the recent spring break holiday, which is ending this weekend. For those individuals who travel for spring break, who engaged in activities where social distancing and masking weren't adhered to, it's important for them to quarantine themselves next week, to get a test at the end of that week, and receive a negative test prior to returning to work or school. That's going to help to mitigate the spread of disease. Typically, what we've seen in prior holidays is the week after, we start to see cases increasing amongst individuals younger than 40. And then in subsequent weeks, we see cases grow in other age groups, older age groups. So if we can get folks who were involved in those activities to quarantine and test, we can limit the potential impact for spread beyond that group that traveled or participated in those activities. And that's going to help us avoid a surge in April and May. Again, we're pleased that we still have our mask mandate in place. We're pleased to see so many businesses enforcing those mask mandates, and we're hopeful that that's going to continue to place Austin and Travis County ahead of other Texas cities and most other U.S. cities in terms of disease spread and deaths. With that, I will turn it over to Janet Pichette.
Good morning, everyone. I just wanted to talk about a little bit, we are seeing record low numbers of cases in the Austin area, and we would like to continue to see that and hope that it's a true flattening of the curve in the Austin metropolitan area. However, we do know that people have been out and about enjoying the spring break holiday and have the potential to come back. We know that there are new variants spreading throughout our community, and we are detecting that. We've been working very closely with UT Dell Medical School, or UT's been doing some genomic sequencing, as the state health department has, and we continue to identify various variants within the Austin area. That includes the UK variant and most recently the California variant. So as epidemiologists, we'll continue to monitor and track what's currently spreading in our community. As both Dr. Escott and Stephanie have mentioned, we have vaccine on the horizon and we're getting people vaccinated. But masking is going to be important to continue to wear that mask to reduce disease transmission, especially if you return from travel or large mass gatherings, to make sure that if you are exposed, that you're not continuing to spread additional disease in the community. We'd like to see our trend continue to stay at an all-time low. You know, how it's consistent with what's happening in other metro areas, but we are also monitoring closely what's happening in Italy and in Spain, where they're seeing a resurgence of cases and a third wave occurring. We don't want that to happen here, and we're hoping that we can keep that at bay. So we'll be monitoring the data very closely over the next week to see what kind of impact spring break will have, and we hope that you all continue to stay safe out there.
Thank you, Janet. At this time, we will now open it up to our pool reporter, Sally Hernandez from KXAN. Sally?
Thank you. Thank you for the opportunity to ask you these important questions. Let's start off with us here at KXAN. Our first question is, we've seen providers in other parts of the state scheduling second doses for people immediately upon receiving their first shot. Since second doses are automatically shipped by Texas DSHS, why has APH decided to not schedule people's second dose immediately?
Now that the process has significantly improved and we know that the second doses are arriving weekly, we are updating our tech system to have the ability to send those appointments out and be able to schedule those at the location and ensure that they are in our system and platform. One of the things that we have been doing proactively is that we have been sending out the second dose appointments to individuals, so they don't have to go on to their profile or log in. They can just wait for us to send them an email or a text message. So as we update our system and have new improvements, that is one that is in the works.
Okay, next question is from CBS Austin. How is the APH registration portal operating after the issues earlier this week? How confident are you that those problems have been permanently fixed?
The registration worked very well yesterday. We were able to schedule about 4,600 folks were scheduled for today and tomorrow at our burger site. We are very confident in the changes that have been made. We also know that as we move along and make other updates to our system, our goal is to make our system as user-friendly as we can. And so we will always be making updates to the system to make it to be a system where it's a friendly system for all that use it.
And I'll just add, I was grateful to see in the COVID-19 bill that was recently signed into law, a significant investment in infrastructure for public health. This is one of the challenges that we've been talking about for a year now, is that lack of investment in infrastructure, particularly IT infrastructure in the past has really challenged us. So that hopefully, not only for the rest of COVID-19, but as we move forward and deal with the other public health issues that face us every day, we'll have better technology to engage the population in order to better care for them.
Next question from the Austin American-Statesman. If the Tony Berger Center mass vaccination site goes well, does that mean expanding vaccinations at the site, or will APH open more mass vaccination sites?
We are very excited about the pilot at Tony Berger. One of the things we always do is we run a pilot in order to work out any type of logistical concerns. We have the ability to do twice that footprint at that location. And we typically do roll it out and use that site more than one time. One of the things that is very important is that we have heard from the public during this time. The large sites are great because we definitely need to get a large number of vaccine out to the public and ensure that we are doing that in a short amount of time. But we've heard from the public that there is a concern that we should have more locations that are in your neighborhood, one that you can easily access. And so traditionally, we have used recreation centers, community centers, churches, and even on-site working with apartment complexes. And so that is some of the planning that we are doing now. And we'll look to do more of that for neighborhood locations.
And I'll add on to that. You know, as more vaccine becomes available, we've got to have a shift of our strategy. Certainly, as the number was limited and we had priority groups, a strategy that includes large mass vaccination sites makes sense because we can focus our efforts, we can prioritize. It's easier to do that and scale that through a mass vaccination site. But as the supply chain improves, we know that successful public health vaccination strategies involves public and private partnership. When we look back at H1N1, the vast majority of vaccines were administered by the private sector. So as Director Hayden Howard mentioned, those vaccines need to be close and convenient to people, needs to be close to where they live, needs to be close to where they work. So the strategy is not just Austin Public Health city and county resources, but also utilizing the more than 350 other providers who can give vaccine in our community. I think as we go through April and certainly into May, we're going to see more and more of those traditional providers having vaccine available for folks so they can just travel down the street and get the vaccine rather than having to drive a significant distance to one of these large sites.
And I'll just add that as these more traditional providers come online, we'll be able to saturate our community more with vaccine. Again, part of this has been focused on the supply that's been available, but as supply begins to increase and supply is spread out to those traditional providers, Austin Public Health will likely return back to the safety net provider for the community because there'll be a whole bunch of other options for people to get vaccinated.
Thank you. Next question is from the Austin Chronicle, and this one is directed for Stephanie Hayden Howard. In the March 9th briefing to City Council and the Travis County Commissioners Court, you said APH had initiated a conversation with a private vendor for mobile vaccine clinics. Can you give an update on any plans for APH to operate its own mobile vaccine clinic?
Currently, we are providing mobile vaccines. We are not utilizing a van to operate that way. What we are doing is we started this process in February. And what we've been doing is we have been partnering with entities that have a large group of people that are seniors and or people with disabilities. And so we have a captive audience there. We send a strike team out and they go out and they provide those vaccines at that site. The majority of the people live there and or receive services from there. For example, next week, our mobile team will be working with Meals on Wheels to provide vaccines. On Friday the 12th, I took that day off. But I volunteered with Meals on Wheels. During that time, I was able to visit with 2 seniors that will be the first 2 that will receive their vaccine on the 22nd. I was able to answer any questions that they had. And so it was a really good experience for me to meet them but then also have an idea about the route that they would potentially take and meet some of the people that will be receiving the vaccine. We will continue that process. We've identified several locations, more even since the 9th, that have a captive audience of seniors and people with disabilities that we want to target. And so we will continue to do that as well.
Thank you. Next question from KOOP Radio. The New York Times this morning reported on the efficacy of delaying second doses in deference to expanding first doses in arms. Is APH keeping pace with CDC recommendations for second doses, or, like the UK, deferring them to provide more first doses?
So I'm happy to answer that. We're currently following the guidance from DSHS. So if it is a 2-shot series, folks are getting their second shot within an appropriate time frame. Certainly there is many public health professionals who would advocate for front-loading folks with their first shot. That's not what the federal government has decided. That's not what DSHS has decided to do yet. But it's certainly, when we look at the efficacy of the single shot, it's very good for Moderna and Pfizer. Obviously gets better with the second shot. But I think this is going to be an ongoing discussion based upon the availability. And I think that we will continue to follow the CDC and DSH guidance on allocation of those resources.
One thing I would like to add is typically what we've shared with folks that come to us for their first vaccine, we guarantee that we will provide your second vaccine. So when we order, at this point now, they're actually coming automatically. So once we receive the first dose, then Texas Department of State Health Services does send out, and about 4 weeks later, they do send out that second dose. And so we're able to go ahead and provide that.
Okay, next question comes from KUT. Were you able to schedule all the people who were kicked out of the vaccine appointment scheduling process on Monday because of technical problems?
According to the information that we shared with the media outlets, we were not able to see the individuals that were in the queue. However, we have had some individuals that proactively reached out to us, as well as us sending appointments to folks that were registered in the system. In addition to that, we are very excited about the outcome of last night to be able to provide 4,600 vaccines. And so, as I stated earlier, we will continue to make improvements to the system so it is a user-friendly system.
Thank you. Next question comes from Univision. What is the current percentage of fully vaccinated individuals in Travis County? Is this number accurate, since people can come and get vaccinated from other locations or even from Mexico?
So the current, I'm happy to answer that. The current numbers of fully vaccinated individuals 16 years old and older is about 11%. So again, about 25% of individuals in that same group have received at least one vaccination. This is based on, as far as we know from the Texas Department of State Health Services database, those are individuals who are Travis County residents. We do know that we have vaccinated a significant number of people who live outside of Travis County. The large majority of those individuals that we vaccinated tend to be in the greater Austin area, Central Texas area, but we've vaccinated people from Houston and Dallas, from Abilene, Seguin, many parts of the state. And again, as a hub, we are obligated to do that. But it does appear that the vast majority are from the Central Texas area.
Okay, next question comes from Community Impact. We've consistently heard reports of people who are not eligible jumping in line, whether that's with public or private providers, sometimes after private registration leaks get shared online. Can you speak to the effort to ensure prioritization of vulnerable groups and what people should do if they don't qualify?
So first, let me say, shame on you. We are in a public health crisis. We have a limited number of vaccines. Those vaccines should be utilized for those who need it the most right now. We have millions of people across this country who want the vaccine, but we have to have a priority system to ensure that the first vaccines go to those individuals who are at the highest risk of having severe disease or who are at higher risk for exposure. Yes, it's an imperfect system. Yes, it relies on people's honesty in answering questions about medical history and where they work and so forth. But I think as a human being, we have to respect the fact that sometimes we can't be the first in line, and that we have to defer those vaccines for those who need it the most because of their risk. I think this is a testament to us as a state, to us as a country, that we can be honest and answer questions honestly to ensure that that those folks who need it the most get it first. We're talking about a short time frame before every adult in America is going to have access to a vaccine. We're talking about 6 weeks from now, we believe. So be patient. Masking, distancing, the other things still work very well. My advice to those folks who don't currently qualify is to continue to mask, distance, wash your hands, do the same things that have gotten you through the past year without getting COVID-19. Those will continue to work, and in time, over the next 6 weeks or so, there should be a vaccine available for you.
I think one thing I would also add is that we know that by looking at an individual, if you see a person that's lined up, you cannot tell what type of medical concerns or challenges that person has. And so typically, all of us as providers, we are working off of the eligibility that has been provided to us by the Texas Department of State Health Services. And so our hope is that individuals are honest when they are going through that screening process, which also makes them eligible in all of our systems. And so our hope is that people are being honest, but we have all set up a process where it does immediately make folks eligible that meet that criteria defined by the state of Texas.
And I'd just like to also remind people that we're still vaccinating the 1A category, which are healthcare workers and first responders who may have not initially got vaccines. So I think we, like Director Hayden Howard was saying, you can't always look at someone and assume, well, they may look young. It may be that they are providing clinical care to somebody who's at high risk. So we are trying to vaccinate those individuals as well. When people present to the clinic and they are eligible for a vaccine, we're not questioning whether or not we see that they're eligible. We're not checking to see whether they have specific medical conditions or if they're a first responder. But, like Dr. Escott said, we're hoping that people are honest about what they're doing as they register and as they complete the assessments for eligibility.
Okay, thank you. Next question comes from Fox 7. Could you please explain the new indoor and outdoor event guidelines and how they were developed?
I'm happy to take that one. So, as our situation improves, as the risk of overwhelming surge begins to dissipate, it means that we can start to look closer at gatherings and sizable gatherings. But as we look at those, each of those gatherings have different aspects which either increase or decrease risk. Obviously, outdoor gatherings are better than indoor gatherings. Smaller gatherings are better than larger gatherings. But it also has to do with the nature of the event. If people are seated facing in the same direction and spacing can be maintained, that's a different story than a concert where people are face to face and alcohol is being served. So we've developed a process with a number of stakeholders to review those gatherings, to make mitigation recommendations and a decision about approval, modification, or delay. As we've been discussing, there is some concern now about what April and May in particular are going to look like. We've seen the projections from the UT Modeling Consortium that if we relax too much, we're looking at a surge which begins in April, continues into May, and peaks in June, which would be very unfortunate for gatherings and other events like proms and graduations. So we have to consider the fact that the situation may get worse, and if it gets worse, then we have an opportunity to try to either further mitigate those activities or cancel them. We have seen some evidence recently over the past 2 days that our hospitalization admissions have been increasing. Again, a sign that things could be changing. But we'll continue to monitor the situation and ensure that any events that are approved going forward are as safe as we can make it and have a minimal chance of being a significant spreading event.
Okay, thank you. Next question is the second question from KXAN. Regarding the city's plan to bring events back, how much of a concern is it that these new reopening guidelines will place additional financial burdens on smaller events? Were event holders consulted on this plan?
Now, we have a number of entities involved in building these guidelines. So there has been some discussions with venues and other groups involved in this space, which would include our Austin Convention Center, as well as other stakeholders. That dialogue hasn't ended. It's going to continue, and we will continue to provide advice for the community, for those venues on how to hold events safely. Again, it's important that as a community, we recognize that the situation is improving. The threat of overwhelming surge is dissipating, but it's not gone yet. And that means for the next several months, we're going to have to, continue those efforts to make sure that those things are safe and that we have an incremental approach to building the size and complexity of those events. When we look forward to the fall, September, October, November, it seems likely at this stage that events during that kind of time frame are going to be normal or near normal, unless we see significant change in the variants and the impact that they may have based on the efficacy of the vaccine against those variants. But right now, it looks very promising for the fall. Again, spring and early summer is a little bit more concerning. There's some more uncertainty there, but certainly as we go through the summer, that risk will further dissipate, and we can expect for things to start to look more normal as we go through the summer.
Thank you. CBS Austin is up next with their second question. What does the vaccine shipment look like for next week? Do you expect it to go back up, and do you expect to receive more J&J vaccine?
Texas Department of State Health Services has been sending us 12,000 allocation weekly. One of the things that we did request is we have requested the J&J vaccine. We did request 12,000 of that as well. We have not received that. But once we do receive that, we will quickly deploy it out into the community. So we are hopeful about receiving J&J. One of the things that an individual will see when they're getting ready to schedule their appointment, we are going to alert them that at this particular facility, it would be Moderna or you will have J&J. So the public will know what type of vaccine will be at one of the facilities that we are operating.
And I'll add, the indications that we have from the Texas Department of State Health Services is that the supply, overall supply, and the supply of Johnson & Johnson is not going to change much in the next week. Beginning in April, we've been told to expect a significant increase in allocation, primarily an increase based upon the availability of the Johnson & Johnson vaccine. Again, the benefit of the Johnson & Johnson vaccine, in addition to its, it's being studied, with the variants or several of the variants, is that as soon as an individual is vaccinated with their first dose, they're fully vaccinated. There's a 2-week window for that efficacy really to be there and to build further from that point. But it really is a game changer in terms of our ability to start to vaccinate people quickly and reach that herd immunity in short order.
Thank you. Next question comes from the Austin American-Statesman. Does it appear Austin Travis County is doing a good job social distancing during spring break? Or are health leaders seeing residents, tourists flocking to local bars and not masking? Any increase in COVID-19 citations given out this week?
Well, I'll say that, I think we've seen a mix of things. I think most businesses are enforcing the mask mandate. If customers come in without a mask, they're asking them to put on a mask or offering a mask for them. Obviously, folks who come in from out of town may not be familiar with the mask mandate here. Again, I am concerned about the situation in bars. I know some bars are masking and others have shared the fact that they're not going to require masking. Again, bars are going to be a dangerous place, not only because of the decreased likelihood of masking, but also the customers they cater to. Primarily, we're talking about people in their 20s, 30s, and 40s, which are the same groups of people who are less likely to be vaccinated right now. As we go through, May or April and May, those numbers may increase, but still, those are going to be underrepresented in terms of vaccine as compared to people in their 50s, 60s, 70s, and 80s. When we look at the summertime months, we're still going to face risk regarding events involving young people, teenagers, because we don't have a vaccine for them yet. So again, I think it's important for our community to recognize where those places of risk are and to avoid those places of risk, particularly until they're vaccinated.
And I would just like to add, this is just another reminder to those individuals that if you are going to be out and about, visiting restaurants or bars or establishments that are opening up and they do have or are asking patrons to continue to wear a mask, that you respect their policy for doing so instead of being confrontational. We have heard about people who have been confrontational to some of these frontline workers that are trying to keep businesses operating and running. So we are asking that people be mindful and respectful to those businesses and industries.
Thank you. Next question comes from the Austin Chronicle. What is the percentage of APH's weekly vaccine allocation going toward vaccinating residents living at Housing Authority City of Austin properties and Foundation Communities properties?
We have included that as a part of our mobile efforts. About a couple of weeks ago, we provided vaccines to the Housing Authority to individuals that are seniors and or people that were disabled. We were at about 4 of those complexes. In addition to that, we have been in conversations with Foundation Communities as well. And so we will be providing vaccines at their locations. And so that is a part of that mobile plan where that strike team goes out and is able to provide those vaccines there.
Thank you. Next question comes from Co-OOP Radio. On Monday morning, I will get vaccinated at the Dell Diamond in Williamson County. Is this information shared by various state and federal health agencies? If not, how do you plan to share this info?
I'm not clear what the question is. So let me answer what I think the question was. If I'm a Travis County resident and I go to Williamson County, are you going to know that there's one more Travis County resident vaccinated? The answer is yes. So the MTRAC2 system tracks vaccinations across jurisdictions. The state gathers all that information and then distributes that information to local jurisdictions. So regardless of where you get vaccinated, it will show up as a Travis County resident being vaccinated.
I think also one thing to keep in mind, this is not new to vaccines. So any provider that has provided vaccines to individual flu or just your regular vaccines, the state of Texas implemented that system several years ago. And so as a private provider, when I provide vaccines, even to an infant, we're required to go in and log those vaccines. So if the family moves anywhere across the state of Texas, that provider can go in that system and they can tell me exactly what kind of vaccine record that I have. And so that is available through the state of Texas.
And I'll just add that for the COVID vaccine efforts, the Department of State Health Services is asking all providers to make sure that information is inputted into the MTRAC2 system within 24 hours of that vaccine being delivered to that client. So ideally, that's how they're keeping track of how many folks are being vaccinated and the demographics of who is being vaccinated. And you know, it's just one of the many mechanisms, but each provider in the state that receives an allotment of vaccine from the Department of State Health Services is required to data enter the information on that client within 24 hours of receipt of that vaccine.
Thank you. Next question comes from KUT. What concerns do you have, if any, about schools starting back up after potential spring break travel?
I'm happy to answer that one. You know, again, we're getting in a better situation in terms of the percentage of folks vaccinated. The school systems are better in terms of higher numbers of school staff being vaccinated. Obviously, school and childcare staff are currently eligible to receive the vaccine. So that's going to help mitigate some of the risk that we were concerned about in the fall with in-person education. We know that transmission may happen among students, really concerned about transmission to school staff. So the risk of the school setting is going to start to decrease. Again, you know, the schools are maintaining the protections that have been in place, the masking, the distancing, the hand washing. the screenings for symptoms. So that's going to help mitigate. I think ultimately, for those who may have traveled or been involved in activities without the masking and distancing during spring break, it's important for them to stay home next week, to do virtual education, to be tested at the end of next week prior to returning to school. That's going to help further mitigate the risk of spread in schools. But schools are going to continue to be a place of risk because the students aren't vaccinated, because they're not eligible for vaccination for the most part. So those protections in schools are going to have to continue for the rest of this semester and probably into summer school. But if we can play it safe now for a little bit longer, then it's going to pay off in the future to avoid that potential April, May, June surge, which is has the potential to really disrupt end of year school activities, prom, graduation, other celebrations at the end of school. So again, we encourage folks to be safe, to stay virtual next week if they traveled, and get a test before they return to school.
I would also like to just add that, I think some of those folks that are at greatest risk in the school setting have been offered vaccine now that Governor Abbott has allowed teachers and childcare workers to become vaccinated. Those who are at greatest risk are actually beginning to receive their doses of vaccine, so that would be an added benefit to the situation. But like Dr. Escott said, we need to continue with our prevention measures of masking and distancing to make sure that we stop the disease transmission cycle.
Okay, thank you. Down to the last question. This is from Univision. Bill SB 26 wants to prohibit the closure of places of worship during situations like the pandemic. How did asking to close places of worship help stop the spread of the virus, COVID-19?
I'm happy to take that one as well. The challenge we have is that we recognize the importance of in-person religious celebrations. It's important to me. But we also have to recognize that church services create a risk of spread. I'm grateful for the diocese here in Austin, for our religious community who came together to modify those in-person services, to offer virtual options for folks to decrease the risk of spread further, in the modifications that are continuing to this day. I think it's a mistake for us to pass legislation which prohibits the potential closure of religious services for future pandemics, because future pandemics may look much different. Remember, for this one, the overall case fatality rates in the neighborhood of 1% to 2%. There's some variation on that number, obviously, but other pandemics, we may not be so lucky. Maybe 5%, maybe 10%. We are constantly under threat of an emerging pandemic in the future. And so I don't think we should use this one to make decisions or limit our possibilities for the future. I think any of those discussions need to be a two-way communication between public health and the religious community, so that we can mitigate the risk of spread while also minimizing the impact on people's religious practice. So our hope is that we can continue those conversations. I think it worked out well this time. I think many of the churches were proactive in closing early on, and that we found that balance between public health and religious health, if you will. So I think that's a model for us in the future, and that we should continue those efforts.
One thing I would like to share is at the beginning of the pandemic, we established a faith-based group. That group worked very closely with our partners in clergy, and their membership, their leads, etc. During that time, we really solidified several really good working relationships that we will continue to work with them on the other side of this pandemic. One of the things that we were able to do is our communications folks were able to produce a handy document. So when they did think about gathering, we just said these are the safe ways to be able to gather in your congregation. Our team also worked together to provide some testing at some churches, and we have provided vaccine. We have provided masking and hand sanitizer to them as well. And so those partnerships will continue. One of the things, as I stated earlier, we are working with the faith-based community to provide vaccines for them, for people that either attend their church and or live in that neighborhood. So those are relationships that we're very excited about that will continue to work together between public health and religion.
Thank you. Now, Stephanie, we can start with your closing remarks.
Thank you. We are very excited about how we are moving forward with providing vaccines. As we move forward with our pilot site at Tony Berger tomorrow, we're going to continue to work collaboratively. We will continue to look at our IT system and make the necessary improvements so we're able to move forward. But as we move forward and more vaccine is available, we know that this is a public-private partnership. And so we are very excited about our partners that are ready to receive vaccine, have the staff, employees that are ready to provide it to our community. And so as things continue to shift and more vaccine becomes available, our hope is to start to transition and be more in neighborhoods, very close, where individuals could even walk to our sites and receive a vaccine in their community. And so, but in the meantime, it's so important for us to continue to wear our mask. It's important for us to wash your hands, watch your distance, stay home if you're ill. We are continuing to provide free testing to the public, and we hope that you, if you have any symptoms or you've been exposed, then you will go onto our portal and register for appointment for a test. At this time, I'll transition over to Dr. Escott.
Again, we are starting to see some plateauing of our hospital numbers. We've seen a slight increase in our admissions to the hospital the past couple of days. It's a reminder that we're not out of the woods yet. If we stay the course, we continue the masking, the distancing, the hand hygiene, staying home when we're sick, it's going to serve us to avoid a surge in April, May, and June. If folks traveled or were involved in activities where social distancing and masking weren't followed over spring break, please stay home next week. Please get a test at the end of the week before you return to work or school. That's going to help limit the spread to other members of our community and will help us to avoid a surge. Again, we're dealing with regular COVID now, as well as at least 2 variants here locally, and those variants are increasing in the numbers that we're seeing, which means we have to be a little bit more careful, and we have to ensure that we are getting tested if we have symptoms or if we've been participating in those activities, which may place us at risk. If we can do that and we can maintain those protections over the next 6 weeks, our risk of surge is going to dissipate very quickly as we approach May. And God willing, we can have a more normal summer and fall next year if we can all continue to work together in the short term. With that, I will turn it over to Janet Pichette.
Thanks. And as Dr. Escott has mentioned, the epidemiologists here at Austin Public Health are watching the data very, very closely. We are seeing numbers of new cases decline, and we hope it stays that way. However, we know that people have been out enjoying spring break and have possibly placed themselves in situations where they've gathered with people without masks or may have unnecessarily exposed themselves. We continue to work with our partners at UT and the Department of State Health Services to identify any newly emerging variants that might be on the scene in the Austin metropolitan area. But overall, I would like to commend our residents in Austin for being mindful about continuing the use of wearing their masks and practicing social distancing, because I do hear from other epidemiologists throughout the state who ask me, how is it you're able to keep your numbers at such a low level? At various points when they were surging at very high numbers, our numbers were still significantly lower. And I would like to say that it's because our community is listening and practicing those prevention measures that keep us all safe and keep our families safe. So with that, I hope everyone's able to enjoy this wonderful weather that we're having. But I would like for you to stay safe out there. And if you do feel like you've been exposed and you return home and you become ill, please take Director Hayden Howard's advice and sign up for a test to make sure that you have not been exposed to COVID and that you can recover easily. So with that, I'll turn it back over to the moderator. Thanks.
Thank you. That concludes our media availability for today. A special thanks to APH Director Stephanie Hayden Howard, Dr. Mark Escott, and Chief Epidemiologist Janet Pichette, along with our pool reporter, Sally Hernandez from KXAN. Thank you for joining us. Have a safe weekend.